Thank you for joining Cancer Support Community Atlanta for this program. Please visit our website, cscatlanta.org, for a complete list of live and recorded events. We invite you to sign up for our newsletter to stay connected to all future programs.
All right, well, welcome and good afternoon, y'all. My name's Lauren. I'm the program director here with Cancer Support Community Atlanta. I'm glad to have y'all logged on with us today for this 4-part series with Savannah. Savannah is the high risk and survivorship dietitian with Northside. She joins us for some of our cooking demos, our nutrition seminars. If you might have seen her if you've ever participated in cancer transitions. Savannah joins us for all things helpful nutrition and seminar related. So thank y'all for joining us, and thank you, Savannah.
Oh, my pleasure. It is so great to be here with you all. I always love doing this series, and it's great to see a lot of new names that I'm not familiar with. So happy that you all have found the cancer support community and gotten plugged into this presentation. All right, so let's just go ahead and dive into it. So we are presenting this series to talk about how we can reduce cancer risk through the things that we can control. Because as we know, many things are out of our control, but there are some things that we can do to give us the best chance of fighting cancer, either an initial diagnosis or recurrence. So this week in week 1, we are going to be talking about the big 8 recommendations for cancer prevention, as well as cover some other frequently asked questions. Okay, let's see. There we go. And just a quick plug. So as Lauren mentioned, I am a dietitian with Northside Hospital Cancer Institute. I specifically am the survivorship dietitian. So I work with patients who are in the survivorship stage of their cancer journey. But I'm also the dietitian for Northside's high risk program. So this is for individuals who have never been diagnosed with cancer, but due to some of those factors we just mentioned that are outside of our control, whether it is genetics or family history, you might be at increased risk of developing cancer. So we're based here in the same building as the cancer support community, and currently we're taking patients who are at increased risk of breast and ovarian cancers primarily. So if that's something that you're interested in, if you are a breast cancer survivor and you think maybe some of your family members would be interested in this, feel free to take a picture or give us a call or an email and we can get you plugged in. All right, so over the next 4 weeks, what are we going to be talking about? So today, as I mentioned, we're going to go over the overview and guidelines for cancer prevention and reducing risk of recurrence. And next week, we're really going to talk about one of the key points that we'll touch on today, which is embracing a plant-based diet. So that's a really fun session I hope you all get to join in on. And week 3, we're going to be talking about how, what are some great resources for us to use? How do we evaluate nutrition research? Where do we go for our information? And we'll also do a little bit of myth busting in that class as well. Okay, and then in week 4, it's going to be a bit of a bonus week. This is primarily going to be for cancer survivors. So if you are in the survivorship stage and you're wanting to get a little bit more information of, managing long-term side effects of cancer treatment and keeping that risk low, managing other chronic diseases, that will be a really great session for you. And I see in the chat, we want that contact information. I'll go back at the very end and go back to that slide or pop the contact information in the chat later on so that everyone has that. All right. Okay, so throughout the next 4 weeks, there are a few words that you've maybe heard before, but I wanted to just go ahead and provide some definitions because you'll likely be hearing them over the next couple of weeks. The first word is carcinogenic, which means having the potential to cause cancer. So if something is carcinogenic, that means we know that there's some research that it's likely increasing cancer risk. Phytochemicals, or also phytonutrients, is another word I'll use a lot. And these are naturally occurring compounds that are found in plants that provide plants with color, they're taste, their aroma. And when we consume them, they have health benefits in our body. So a lot of people are familiar with lycopene. That is a phytochemical in tomatoes that makes them red. It gives them their red color and their flavor as well. You'll also hear me say antioxidants. These are substances that prevent damage to our cells from unstable molecules called free radicals that kind of, they enter into our body through usually the environment. So many phytochemicals and vitamins are also antioxidants. And antioxidants are helpful in fighting inflammation, which is the body's immune system to an irritant or an invader. Lastly, you'll hear the word micronutrients, and this is referring to vitamins and minerals that are needed by the body in small amounts. So a lot of us are familiar with the macronutrients, so protein, carbohydrates, and fat. But those micronutrients are things like calcium, vitamin C, vitamin E, and so on. All right, so where am I going to be getting all this information from? So I take these recommendations from the American Institute for Cancer Research, which is affiliated with the World Cancer Research Fund, which really funds a lot of quality, evidence-based research, particularly in regards to the impact of diet, physical activity, lifestyle on cancer prevention and also cancer survival. So this is a really great resource if you want to do some more, if you want to go to a website after today and kind of get some handouts or maybe see a lot of these recommendations kind of in handout form, this is a great source of information. So as I mentioned, we know that there are some risk factors for cancer that are outside of our control, things like that family history, genetics, and so on. We also know that there are quite a few things in our control that impact cancer. So that's going to be having an unhealthy diet increases cancer risk, being an unhealthy body weight, alcohol consumption, physical inactivity, tobacco use, sun exposure. Those are all things that can really affect our health. They can affect cancer outcomes. But the good news is we have some autonomy and decision making of our own that we can do to help reduce that cancer risk. Back in 2014, which was the most recent I could pull this data, about 18% of cancer cases, so new cancer diagnoses, were being attributed to these, lifestyle factors. So that's almost a fifth of cancer cases who could have potentially been prevented if maybe we had instituted some of these lifestyle factors earlier on. But it's never too late, so I'm glad everyone is on here today to learn these things. Okay, so what are these recommendations? I'm going to go through them quickly and then we're going to break them down one by one. The first one is we want to work towards or maintain a healthy body weight. We also want to be physically active, eat a diet rich in whole grains, fruits, vegetables, and legumes. On the opposite side of that, we want to limit consumption of fast foods and other heavily processed foods that are high in saturated fats, refined starches, and added sugars. We do want to limit consumption of red meats and try to avoid processed meat, as well as limit sugar-sweetened beverages and alcohol consumption. We also want to make sure that we are not using dietary supplements for cancer prevention. Now, don't worry if that makes no sense right now. Like I said, we're going to dive into that a little deeper later on. And for mothers, if you have the option to breastfeed your baby, that is shown to help reduce risk in both mother and baby of cancer. Lastly, if you have had a cancer diagnosis, we want to adopt these recommendations as we are able to help reduce the risk of recurrence. All right, y'all bear with me 1 second. I'm going to move my little bar so I can read my slides better. Okay, so we're first going to talk about the top recommendation, which is arguably one of the biggest things we can do after not smoking to help reduce cancer risk. And that is work towards maintaining or achieving a healthy body weight. So we know some statistics that nearly 40%, almost half of Americans are obese. Many more than that also fall into the overweight category. And again, back in 2014, if we're looking at cancer cases and what's attributed to them, we're guessing that about 11% of cancer cases in women and almost 5% in men are attributed to overweight and obesity. The good news is moderate weight loss, so you don't even have to, lose every excess, pound that you might have, but even a mild weight loss may decrease risk of breast and endometrial cancers. So on this slide here, you'll see that there, I believe it's 13 cancers that overweight and obesity have been linked to. So esophageal, liver, kidney cancer, ovarian, and breast, um, cancers of the pancreas and gallbladder, as well as prostate cancer, are all linked with overweight and obesity. And that last little note here is that about half of Americans aren't aware of the link between obesity and cancer. So if you're on this call today, that's great. We're increasing the number of people who are aware of that link. So how do we determine obesity and overweight status? Well, there's a couple measures we can use, but the quickest and the most affordable, the less invasive option is BMI. This is really a ratio of height to weight. And taking that number, we're able to kind of categorize into an underweight, a normal weight, an overweight, or an obesity category. This is usually what physicians and also dietitians are using. But I do want to point out this is a tool. It is certainly not 100% accurate. It does not take account for things like breast tissue, muscle mass. And when it was created a couple hundred years ago, it also wasn't utilized in the most diverse population. So this is just a rough estimate. There is certainly not the end all and be all of weight status, but I want you to be familiar with it because if you're having conversations with your doctor, they might throw this term out and categorize you one way and kind of use that to help make decisions for your plan of care. Okay, so before I move on to physical activity, one thing I'd love to mention is that when I'm working with my patients and we're working through these recommendations, a lot of times weight loss or weight management is a goal. But the good news is that most of these other recommendations we'll talk through today can help to achieve that healthy body weight. So it's not my preference to focus solely on the weight. If we focus on adding good nutrients in, moving our body, not consuming too much of those things that we know aren't giving us the most nutritional benefit, a lot of times that weight aspect follows. So I just want that to be a little bit of encouragement here. Okay, so physical activity. We know that physical activity is linked to lowering risk of several kinds of cancers, specifically breast, prostate, and colorectal cancer. But beyond that, being physically active helps with just our overall quality of life by improving muscle mass, helping with, our metabolism, caloric balance, helping us to feel strong and flexible and able to move around and perform all of the activities of daily living that we want to perform. It's also so powerful in fighting fatigue and improving mood and memory. So a lot of times with patients going through treatment, if some physical activity is an option, then being able to just walk or do yoga, even a little bit more than what they were previously doing, can help them fight fatigue. And so we see that in practice with cancer, but of course in the survivorship stage as well, this is incredibly important. Being physically active also helps to fight inflammation in the body. It can help with hormone balance. And like I said, just a great mood booster. So we're big fans of physical activity. But specifically, the AICR gives us some specific recommendations. Okay. So there are two kind of guidelines for getting started with physical activity. They're recommending either a minimum of 150 minutes of moderate physical activity a week or a minimum of 75 minutes of more vigorous intensity physical activity each week. So moderate intensity is something that, you maybe you can talk during, your heart rate's getting up, you're not horribly winded, your heart rate's not through the roof. So things like brisk walking, water aerobics, playing doubles tennis, gardening, yard work, or maybe you're raking leaves or digging holes. Whereas vigorous, intense physical activity is things that maybe you're having a harder time talking through. You certainly couldn't like sing a tune while you were doing it. So jogging, high intensity interval training, swimming laps, singles tennis, playing basketball. Those are all some examples of vigorous physical activity. So I like these numbers because it's kind of a great idea for you to kind of stop and compare what your current physical activity is in relation to these numbers, and then going from there to kind of set some goals and see what you can do to help get more in alignment with these recommendations. Beyond that, the AICR also recommends, in addition to, intentional physical activity and exercise, just being less sedentary has a huge impact on our health. So sedentary behavior is anything like sitting, lying down, watching TV. Unfortunately, sitting at the desk all day at work, I'm guilty of that. I sit in front of a computer in front of patients all day long. So it's a great idea to try to reduce the sedentary time and increase our physical activity where we can. Things like choosing the stairs, riding a stationary bike, or walking on the treadmill while you watch TV, using a Fitbit or your Apple Watch to track your steps, combining social events with movement. So maybe instead of going out to eat with friends, maybe going line dancing or heading to the park or playing a sport. Those are all great ideas. And I want to shout out Lauren because before we got on the call today, we were talking about this, and she was like, I've got a busy afternoon. I'm not going to get my exercise in, so I'm going walking on my lunch break today. So, simple as that. If you have an extra 10, 15, 20 minutes at work where you can go do a lap, those steps absolutely count. All right. So this next recommendation is one that I really consider part of the heart of cancer risk reduction, which is why we're going to talk a lot more about this in depth at next week's session. So the recommendation is to eat a diet rich in whole grains, vegetables, fruits, and legumes. So essentially, trying to make the majority of your plate whole, minimally processed plant foods. This is because plant foods are full of those phytonutrients that we talked about, so polyphenols, antioxidants, things that can fight inflammation in our body, and also play a role in certain, disease processes, including preventing cancer in the body. These foods are also higher in fiber, and we are more and more seeing research that points to higher fiber diets being linked with reduced cancer risk. So a specific guideline is trying to aim for about 2/3 of your plate being plant foods. All right, so more on plant foods next week, but we also mentioned that we want to make sure that we're not consuming too many heavily processed foods. So those foods that are high in those saturated fats, added sugars, and refined starches. Unfortunately, a Western diet, which is what we have here in the States, is associated with a higher risk of cancer because of likely all of these, less nutrient dense sources of calories, essentially. We're getting energy in the form of calories from these foods, but we're not getting a lot of fiber. We're not getting a lot of phytonutrients. So they leave less room in our diet for those great plant choices. And of course, a benefit of monitoring or eating these foods in moderation, saving them for special occasions, is that they can also help with overall calorie intake as well as a healthy body weight. Oops, excuse me, went a little too fast there. All right. So this next recommendation is we want to make sure we are limiting red meat and avoiding processed meat as much as we can. So, what we know is that processed meat specifically is a carcinogen. It is known to be cancer causing. So, we're currently taking the position that we want to avoid processed meats as much as we can. So, our processed meats are going to be things like your breakfast sausages, bacon, hot dogs, cured ham, pepperoni, as well as, unfortunately, deli meats, which I know is a big disappointment because deli meats are so easy. They're such an easy thing to put on a sandwich or throw in a salad. But unfortunately, right now we are recommending to limit those foods or avoid them completely if we can. Red meat is not quite at this time carcinogenic. We do think it is a contributor to colorectal cancer specifically, but moderate amounts of red meat don't seem to be increasing it. So if you're having red meat at really high intakes, which is considered more than 12 to 18 ounces per week, then you might want to be cutting back. So if you're staying within 12 to 18 ounces or less per week, you're more than likely okay with what the research is saying at this time. Our red meat is going to be our beef, our pork, and our lamb. So what does that leave? We've talked about eating a lot of plant foods. We've talked about maybe monitoring, limiting red and processed meat. The meats that we're not seeing any link with cancer at this time are going to be our chicken, our turkey, other poultry, and fish. Okay, so next up, we want to limit our consumption of sugar-sweetened beverages. So this is anything from, your sugary Starbucks drink to a soda to many fruit juices, punches, things of that nature. Now, the reason why we want to limit the consumption of these is not because sugar increases cancer. We'll talk about that more in a couple minutes. So sugar is not causing cancer, but what it is doing is adding a lot of empty calories without the benefit of feeling full or getting much other nutritional value. And again, when we're doing that, we're leaving less room in our diet for those great nutrients that we want to be getting, and it can make it harder to maintain a healthy body weight. A lot of times I'll have patients come in and see me and say, "Man, I feel like I'm eating all the right things, but my body weight is still higher than I feel it should be. What can I do?" And we'll do a diet recall, we'll look at everything, and we'll say, "You know what? You're eating the right things, but you're drinking 3 sodas a day, which adds up in a lot of calories. We can cut that back." We see great improvement in some of the nutritional goals that we're working on, including also just being better hydrated, which has a huge impact on things like headaches, fatigue, energy level. So I see some really great results with cutting down on sugar-sweetened beverages. If you need help to cut back on this, another little tip I like to give, I like to leave tips as they tell you to avoid things. Feel free to infuse your water with fruit, or if you're used to drinking fruit juice, you can dilute that with water decrease how much fruit juice you're getting. You could also try some of the water flavoring agents that are out on the market right now, like a Crystal Light, to kind of wean yourself off of more of the high sugar drinks. All right, this recommendation makes me unpopular, but the American Institute of Cancer Research is recommending that we avoid alcohol if we can. Unfortunately, all alcohol, whether it is a beer, a wine, or a liquor, is considered carcinogenic. And that has to do with just the ethanol, that's present in all of these alcoholic beverages. And we are seeing links to cancer with really any amount of intake. They're recommending, if you do choose to drink alcohol, for women, we want to limit it to 1 drink a day, and for men, limiting it to no more than 2 drinks a day. Now, this doesn't mean that, if we avoid alcohol, 6 days out of the week, on day 7, we get to have 7 servings. Unfortunately, it doesn't work quite that way. We're still recommending in 1 day, limiting it to 1 drink. With that being said, certain cocktails might fall into that sugar sweetened beverage category. So there's kind of an added risk with those of maybe adding more calories, keeping you know, less hydrated, and contributing to some of the weight or other goals you might have. So experiment with mocktails. I think the cancer support community at the end of this month, or maybe it was last week. Lauren, if you're on, feel free to correct me, but they did a mocktail mixer, which I think is so much fun. So feel free to experiment with that. You know, if you're having friends over, you know, make that a part of your social time, is have some fun mocktails for everyone to kind of experiment and enjoy together. Okay, so as promised, I'm going to explain the recommendation to limit or to avoid use of dietary supplements for cancer prevention. Lauren said mocktails were last week. Well, I hope some of you got to join in on that last week. Okay, so what we know about dietary supplements is that 60 to 80% of cancer patients have taken supplements before, during, and after diagnosis and treatment. And everyone takes these with good intentions, right? Like you want to get a nutrient in that maybe you're lacking, or you read about a great antioxidant and you want to take it in supplement form to make sure you're fighting inflammation in your body. Well, unfortunately, there are a few issues with this. The primary issue being that supplements are not regulated by the FDA. There's truly no guarantee that what you're getting in a supplement is what they're disclosing on the label. Unfortunately, consumer reports are showing us, I think it's, 80% or more of the supplements on the market don't have in them what they're claiming to have in them. And of course, especially when it comes to cancer and cancer treatment, we don't want anything, we don't want you taking in anything that we don't know is going in your body, because we don't want to interfere with chemotherapy, or having some other adverse consequence. Beyond this, our bodies prefer to get our nutrients from food. So if we're getting a well-balanced diet, we're getting all the macronutrients, and we're getting a variety of plant foods for an abundance of micronutrients, there's a good chance that we don't need to be taking additional supplements to get that nutrient in. So not only is our diet typically sufficient, if we're making sure we're following the recommendations for a healthy diet, but our body tends to utilize the nutrients better when they are coming from food. In addition to that, another reason we don't recommend supplements for cancer prevention is a lack of research on many supplements, or even many nutrients at a high dose. So supplements typically provide people with a much higher dose than what they would be getting from food. And in some cases, too much of a good thing can become a bad thing. For example, vitamin E in supplement form there's research to show that in smokers actually increases risk of lung cancer, even though it's an antioxidant. That's just one of many, many examples where this is the case. I'm more and more seeing patients come in taking, an antioxidant blend or an herbal supplement. For example, turmeric is one that is really popular right now. So turmeric it's a spice, but there's an active ingredient called curcumin in it that can help fight inflammation. Well, for most people, there's a couple medications that curcumin and turmeric interfere with, including some chemotherapies. But for most people, getting it through the diet is perfectly safe. But when we take it in supplement form, it can have impacts like impacting how our iron is absorbed and competing with other nutrients and the processes that they have in our body. So again, this is just one example, but the point I'm trying to make is we just want to really be careful that you're taking the right thing at the right time, and that your physicians, your care team are aware of what you're taking. So if you think you might need a supplement, go ahead and talk to your physician or your dietitian to make sure it's right for you. I also want to say that this is not to say that all supplements are bad. There is absolutely a time and a place. If we need to have a multivitamin because you're struggling to get all the food groups in, that might be appropriate. Or if your lab work was conducted and you were deficient or low in vitamin D, a supplement might be appropriate at that point. But for the most part, we want to make sure we're not taking in, extraneous supplements without really knowing what we're putting in our body and for what end. Okay, just checking the chat here. So no questions yet. All right. So with that being said, there are a couple of supplements that I do see that typically don't give me any cause for concern. The first one is vitamin D. I recommend that all my patients, regardless of a cancer diagnosis, ask their physicians to take their vitamin D levels at least once a year, if not more than that. This is because a lot of cancer patients are found to be deficient with vitamin D. It could be, it could be correlated. It could be a coincidence since so many people in general are deficient in vitamin D. Or maybe there is some, link, whether it's the chicken or the egg between vitamin D and cancer. So going ahead and checking that regularly can help guide whether or not you need a supplement. Omega-3 fatty acid supplements are great for fighting inflammation. There's some research that they can help reduce muscle wasting during treatment. They're also great for heart health. I'm usually not concerned if I see someone taking an omega-3 fatty acid. Probiotics is a similar story. Probiotics are trending more and more now. They help to increase and have a healthy gut microbiome, and they also may help increase improve our immune system. We're still kind of figuring out some research there, but we're seeing some good research. What I will say about probiotics is they're not all created equal, so I still recommend maybe making a probiotic choice with your care team so that you're taking the right kind and the right dose to get the result that you're looking for. Lastly, I see a lot of calcium supplementation, especially after cancers like breast cancer, any cancer where you might get on long-term hormone therapy. Calcium is great for bone health. Again, this is something you might be getting plenty of in your diet, but you can talk to your doctor about whether or not you think you might need calcium for your bone health or for another reason. Okay. So someone is asking if omega-3 fatty acids are good for vegetarians. It certainly can be helpful. Pescatarians consume fish, which is one of the foods highest in those omega-3 fatty acids. So if you are a fish eater and you're getting fish 2 to 3 times a week, you might not need the supplement. If that's not something you're consuming, you might be getting some of the omega-3s through certain nuts and seeds or other food sources. But you could maybe consider taking it to just kind of cover your bases. All right. So for moms, I mentioned earlier, but if you're able to, breastfeeding your baby has been shown to reduce cancer risk in mother and baby. And the mother, this is because when you're breastfeeding, certain hormones that are linked to cancer, like estrogen, are lowered during the breastfeeding process. So you're exposed to those hormones over less, in less amounts over the course of your life. Also, at the end of breastfeeding, the body gets rid of any cells in the breast that might have DNA damage. So it almost kind of, I think of it as taking the trash out. It kind of takes the trash out in your DNA of certain cells that have damage to help give you kind of a fresh DNA palette after breastfeeding. For babies, we see that it actually lowers the risk of being overweight or obese later in life. And of course, as we established earlier today, maintaining that healthy body weight is associated with reduced cancer risk. Now, lastly, after a cancer diagnosis, if you are able, we want to follow these recommendations as closely as you can to help improve the quality of your life after a cancer treatment and reduce the risk of cancer recurrence. It also helps to reduce the risk of additional chronic diseases, heart disease, diabetes, kidney disease, so on and so forth. And if you've had cancer, the last thing you want to deal with is an additional chronic disease. You've probably had enough medical care for, your lifetime. Of course, there are certain caveats to this. Keep in mind it says follow these recommendations if you can. If you've had surgery on your colon, following a high fiber diet might not be realistic for you in the short term or maybe even the long term. Or some of these other recommendations like physical activity might be harder for you, especially immediately after treatment. All right, so we have breezed through the 10 recommendations from the American Institute. So now I want to address some frequently asked questions that I get. So we're going to do a little bit of myth busting right now. We'll also do more of that in session 3. Okay, the first question, is organic better, or do I need to consume only organic foods? Organic refers to foods that have been grown or produced without the addition of artificial chemicals. There's usually very high standards that organic product manufacturers have to follow. So certain pesticides they can't use, or certain amount of years or type of soil that's being used. Same thing with animals, organic grass-fed beef, for example. There are going to be some very specific standards that those farmers will have had to have gone through in order to be labeled USDA organic. Conventional refers to products that are not organic. So maybe we're produced using, a pesticide or some kind of chemical. At this time, there is very little research indicating that macronutrient and micronutrient composition vary between organic and conventional products. Now, there is some research that some organic products might have slightly more, nutrients compared to the conventional, but there's also other nutrients that conventional products actually have a little bit more of. And truthfully, the ones that I'm seeing that organic produce and organic products have a little bit more of that nutrient are typically nutrients that very few people are deficient in anyway. We also are not seeing any consistent research on an association between cancer and organic or conventional products. Keep in mind that having the word organic on it does not necessarily mean healthier. If we're looking at a product, so something packaged with a nutrition label that says it's organic, it could still contain, a large amount of sodium or added sugar or saturated fats. So some of those foods that we're recommending you limit. Truthfully, the best benefit I'm seeing with organic produce or organic, produced products is the environmental impact. Now, with that being said, if organic produce is something that you can afford and it gives you a little bit of peace of mind to know that you're choosing organic, then by all means, I wouldn't discourage it. But the most important thing is that you're getting a variety of those plant foods, whether it's conventional or organic. Okay, what about soy? Do I need to be avoiding soy products? Maybe I'm at high risk of breast cancer or I've had breast cancer. So soy is a protein or a high protein legume native to Eastern Asia. It has many different nutrients in it. It's typically high in fiber and it's loaded down with phytochemicals that have been studied for their effects on cancer prevention. Back in the 1980s, we first started really looking at soy, and researchers noticed there are these compounds in them that looked a lot like estrogen. They binded to the same receptors that estrogens binded to. These are called phytoestrogen, which means little estrogen. So they thought, well, if we're getting a lot of phytoestrogens, it might be increasing the estrogen in our body and putting us at increased risk of breast cancer. So for decades following that, we were recommending that soy is limited. But since then, more and more research has been done, and we actually are taking the opposite stance. Really, we are seeing that soy is likely protective against breast and other hormone-related cancers. There's a couple reasons for this. One, potentially that phytochemical component, but also those phytoestrogens that bind to the same receptors as estrogen are actually blocking and preventing extra estrogen from binding. So that is another, hypothesis for why we're seeing decreased risk of cancer with some soy consumption. And in Eastern Asian populations where soy is more of a typical part of the diet, we're also seeing fewer rates of breast cancer in those populations. So at this time, we don't have a specific recommendation for yes, you should be consuming this amount of soy. But when I'm talking with patients, often 1 to 2 servings is safe and potentially even protective against cancers. One thing we are not recommending is taking soy supplements or like a soy, an isolated soy protein. There's not much research that's been done on that at this time, so we're not 100% sure what the link between cancer and soy isolates are. But whole soy foods, things like tofu, edamame, soy milk, those should be completely appropriate and a great source of plant-based protein as well. All right. So what about sugar? Does sugar feed cancer? This is a pretty common belief, and if you get on Google, you'll probably run into some different sources, maybe even some physicians saying that sugar does feed cancer. So what we know is that the sugar cancer link is indirect, and all sugar is not created equal. So to break this down a little bit, our body takes carbohydrates, so whether that's from a sweet potato or brown rice or a glass of milk or a piece of fruit or a candy bar, and it breaks it down into glucose. That glucose is our body's preferred source of energy. So it takes the glucose and it brings it into cells to use it for energy. Now, people are saying, okay, well, cancer cells tend to develop more rapidly than normal healthy cells. So should we starve it of that glucose in order to not let it, rapidly produce? That's one thought, but what happens then is if we avoid all carbohydrates, all foods that convert into glucose, your body actually makes the glucose itself. So the cells still end up getting glucose. But how it does that is it actually is at, kind of our detriment. It breaks down our muscle. Anyone who's been through cancer treatment knows that muscle loss is the last thing we want. Not only does it affect our muscles, it also has a really big impact on our immune system and it decreases immunity. Now, if we avoid all carbohydrate foods, in addition to that muscle wasting we'll likely experience, you're going to feel really fatigued, very tired, and you're not able to get all of those phytonutrients or to get a high fiber diet, which the impact on those on reducing cancer risk is significantly more important than any minor research that shows that carbohydrates could increase cancer risk. With that being said, like I mentioned, not all sugar is created equal. We want to be consuming those whole, minimally processed plant foods, so our complex carbohydrates. But what we do want to limit is added sugars, things that are in those sugar-sweetened beverages or in our alcoholic beverages, our candy bars, our baked goods, those foods that we already know aren't offering us nutritional benefit. The reason why we want to limit that is because, again, sugar adds a lot of calories, which can make weight management more difficult. So yes, sugar can affect our cancer risk, but it's more indirect and it's more because of the impact on our body weight versus sugar feeding our cancer cells. Okay. All right. I believe this is the last myth we're going to bust today before I kind of open us up to some more questions. One myth is that, or I guess question is, should I consume an alkaline diet? So if you're not familiar with this, our body lives on a pH scale. where it likes to stay neutral at about 7.4. Beyond 7.4 is considered acidic. Less than 7.4 is considered alkaline. So what has been hypothesized is that of and too much acidity in our body can increase cancer risk. So we want to have more of an alkaline environment because cancer can't survive in an alkaline environment. Well, this is true. Cancer cannot survive in an alkaline environment, but neither can our healthy cells. Our bodies are so smart. They have built-in mechanisms to prevent our blood from becoming too alkaline or too acidic. Certain foods that are considered alkaline and alkaline water cannot change the blood's pH. It will only change your urine's pH. And it does that because your body's trying to get it back to that neutral 7.4, so it excretes the alkaline substances into your urine. We're really not seeing any improvement with alkaline water. If this is something you've heard of or tried before, alkaline water tends to be pretty expensive. So really you're kind of paying for expensive urine, in all honesty. However, if you like the taste of alkaline water and it helps you stay hydrated, then by all means, that can be a helpful tool in your cancer fighting tool belt. Okay. All right, I lied. There is another myth buster. So should I be juicing? Juicing has become much more common over the past couple of decades and really in the past few years. In January, I see an uptick in patients wanting to fast or juice after the holidays and to start their year off strong. And the reason people want to do that is because the marketing that we hear is that juicing helps detox the body. It gets rid of toxins. Well, really, it's not really doing that. Our liver, our organs do this themselves. And unless you have like a liver disease or something along those lines, it should be doing it just fine. There's no evidence that juicing actually detoxes the body, nor is there evidence that it decreases cancer risk. However, it can be a great way to add more micronutrients to your diet. But just know if you're juicing in order to get more fruits and vegetables in, it's likely going to be higher in calories than you think it will be. And it's also not going to be providing any of that fiber that we know is so important for fighting cancer. If you do choose to juice, focus on getting more vegetables than fruits, including cruciferous vegetables, and only drink what you would eat. If you're juicing way more produce than you would eat, you're really going to be tacking on those extra calories. Juicing also does not give us the right balance of macronutrients that we really like to see, specifically protein. If you're only juicing, you're going to not be giving your body the protein it needs, again, potentially decreasing your immune system, and also just be missing out on feeling full and satisfied. Lastly, remember food safety. Many juices that you buy are not pasteurized, meaning that there's more potential for foodborne bacteria or illness through non-pasteurized produce. If you're juicing yourself, you really want to make sure that you're cleaning off all your produce well. So again, we're minimizing exposure to any of that bacteria, especially if you're a survivor or are still going through treatment and you're trying to keep your immune system strong and not introduce anything that's going to compromise that. All right, so before we dive into questions, a couple of resources I just wanted to throw up here for you all. If you are a Northside cancer patient or you're interested in just general outpatient nutrition services, feel free to call this number on the screen. That will put you through to our scheduling team and we can figure out how we can best serve you. I also like to include Northside's behavioral health. Oftentimes, food and emotions and stress, really just stress and anxiety around cancer or your risk of cancer can be pretty high. So feel free to seek assistance with that, and behavioral health again can help set you up with that. As I mentioned, the AICR.org is a great website for more information. That's where we're getting all of these recommendations from. They have some great challenges that you can do, some great recipes, and they also have a BMI calculator available. Cancer.org is the American Cancer Society. They're another great resource, and they have this pretty much the same prevention guidelines. It might just be worded a little bit different. All right. So I love this 4-part series because we get to follow up with each other throughout the throughout the month. So I like to issue a little challenge. So you can pick one or you can come up with your own or you could do all 4. But a couple things that I would encourage are maybe track your fruit and vegetable intake for a couple of days to determine how many you're getting on average each day. Then intentionally start to increase those servings. This is great, especially as we prepare for next week when we talk about plant-based eating. Another challenge is maybe increase daily physical activity by 10 minutes. Again, this could be done by taking a walk on your lunch break at work. Or you can swap this week's alcohol with a mocktail, an unsweetened drink, or even water. A little less exciting, but still a great option. And lastly, I'd encourage you to maybe try bringing your lunch to work if you're usually going out for fast food, to help cut back on some of those heavily processed foods.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.